Good evening, folks. Tonight's discussion A is Medicare 2026. What's behind the cuts and cost hikes? Okay, I'm going to go through those for you tonight. Hope this helps somebody understand the 2026 Medicare circus, as I call it. Here we go. The headline: Medicare 2026, major insurers cut plans, raise cost for seniors, signals a pivotal shift in the landscape of senior health care coverage. It reflects two covering trends: private insurers scaling back their Medicare Advantage MA and Part D prescription drug offerings, and a projected rise in costs for millions of Medicare beneficiaries. These changes are rooted in financial pressures, regulatory adjustments, and evolving healthcare utilization patterns, and they carry serious implications for access, affordability, and continuity of care. Why major insurers are pulling back. Insurers like United Healthcare, Humana, CVS, Aetna, and others are reevaluating their Medicare portfolios due to a mix of economic and policy factors. Shrinking margins, federal reimbursement rates for MA plans are tightening, especially in regions with lower risk scores or utilization. At the same time, medical inflation and increased demand for services, especially post-pandemic, are driving up costs. Regulatory shifts. CMS, Centers for Medicaid Services, has introduced new rules around risk adjustment, star ratings, and marketing practices. These changes affect how plans are evaluated and paid, prompting insurers to exit markets where profitability is uncertain. Strategic retrenchment. Rather than offering broad national coverage, insurers are concentrating on high performing regions. This means some counties will lose access to certain MA or Part D plans, entirely leaving beneficiaries with fewer choices. How seniors' costs are rising. The financial burden for Medicare enrollees is expected to increase in several key areas. Part B premiums. These monthly premiums, which cover outpatient care and physician services, are projected to rise significantly in 2026. This affects nearly all Medicare beneficiaries, regardless of whether they're in MA or original Medicare. Part D drug costs. While average premiums for standalone Part D plans may dip slightly, the maximum deductible and catastrophic out-of-pocket thresholds are increasing. This means higher upfront costs and delayed financial protection for those with expensive medications. Medicare Advantage trade-offs. Many MA plans are trimming supplemental benefits like dental, vision, and fitness programs. Others are narrowing provider networks, which can lead to higher out-of-pocket costs for out-of-network care or longer travel times to see preferred providers. Access and provider impacts. One of the most disruptive consequences of these changes is the reshuffling of provider networks, hospital and specialist access. Some major hospitals and physician groups are being dropped from MA networks or switching affiliations between insurers. This can force beneficiaries to choose between changing doctors or switching plans. Continuity of care risks. Seniors with complex conditions or long-standing provider relationships may face interruptions in care if their plan no longer covers their preferred provider. What beneficiaries should do. With open enrollment running from October 15 to December 7, proactive review is essential. Checking your plan's status. Confirm whether your current MA or Part D plan will be available in 2026. If it's being discontinued, you'll need to select a new plan. Compare carefully. Look beyond premiums. Evaluate provider networks, drug formalities or formularies, deductibles, and supplemental benefits. A lower premium may come with hidden trade offs. Consider alternatives. If MA options are shrinking in your area, you may want to return to the original Medicare and pair it with a Medigap. Policy and standalone Part D plan through availability. Though availability and underwriting rules vary by state. The bigger picture. This shift underscores broader tension in Medicare policy, balancing costs containment with comprehensive coverage as insurers recalibrate their offerings. Seniors are left to navigate a more fragmented and potentially costly system. The 2026 changes are not just administrative, they reflect deeper structural challenges in how Medicare Advantage plans is financed and regulated. For you and others working on culturally responsive aging interventions, this moment offers a critical opportunity to support seniors, especially in marginalized communities, with clearer guidance, outreach, and advocacy, ensuring equitable access to care means helping people understand their options, avoid coverage gaps, and maintain continuity with trusted providers. Okay, guys, that is A for today for you. I will be back on tomorrow for shows. For now, Gator Wellness, take care, folks.